This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and I'm presenting on a pattern of lower pubic joint dysfunction which I discovered perhaps 10 years ago. The traditional approaches to evaluation of the pubic bone include palpation of the front of the pubic bone on these tubercles called the adductor tubercles or pubic tubercles, and also palpation of the very top, which is called the crest. I started palpating, of course, those parts as well, and I started sliding across one side to the other, sliding across the front. But I also included the middle of the joint, of the front face of the pubic bones, and also the lower part, and was surprised to discover a pattern that has not been described in the literature in which the lower pubic joint is rotated. And so the axis is through the superior aspect of the joint, and it rotates posteriorly such that palpating side to side, only the left lower portion of the pubic bone is posterior. And when the person is prone, that rotation of the pube moves this ischium posteriorly, and there will be blocked motion with a posterior to anterior spring at the ischium with that pattern. Now that pattern can exist by itself, or it can exist within a more complicated pattern of dysfunction involving the pelvis on both sides. And for now I'm only going to present on the simple pattern. And the treatment I use for that is to restore anterior rotation by placing firm foam 2" by 4" by 8" underneath the lower ischium and maintaining that for 5 minutes. This is a very strong joint. The fibrocartilage in the middle of it is 1 inch to 1.25 inches long, and it's 10 millimeters deep, and although it's only 2 to 4 millimeters wide, it can be a little bit wider in postpartum women. But also realize that those fibers extend laterally, so it's a very, very strong joint. And so it takes an element of time and the element of a fulcrum to restore normal movement to that structure. But usually it's a one-time treatment, and this concludes my presentation on a lower left pubic bone rotation. Thank you very much.